I had a family member who passed away from a missed lung cancer. And that problem for patients, the detection of lung cancers in the population, is one that's actually been solved for years and years now. There are dozens of companies that have solutions that use AI, machine vision. The challenge with AI, particularly in healthcare, has been that last mile for adoption. That's been a perennial challenge within the healthcare space.
You know, we hear so often about the negative effects of the AI revolution, but there are so many positives as well. For example, Ferrum Health is deploying AI to make services more efficient and to screen over 1,000 more patients a year. Minimum, but that's just the beginning. And our guest, Pelu Tran, the CEO of Ferrum Health, is really going to tell us the reality of where the opportunity is and the future of medical innovation with his company, Ferrum Health. This is Mind the Machine up next. This podcast is brought to you by our sponsors at Edward Jones, accredited wealth management advisor, Mark Rule. Funny, I think when you and I were doing the pre-call, I was actually in a hospital visiting a relative, trying to figure out what their narrative care plan was. And there were 4 doctors involved and, papers everywhere. There was some, digital fluidity, but not enough to the aspect that you're speaking of, the potential of where AI is today.
I mean, that's a solved problem. And you could feed all that information into whether it's Anthropic or Claude or ChatGPT, and you could get an extremely summarized plan that's going to tell you what you need.
What I ended up doing? I ended up recording each of the conversations with each of the doctors, and then I put it in Grok. I let him know. I'm like, listen, I'm trying to get a sense of this. Put it in Grok, and I'm like, this is what I hear you saying. This is what I believe, and it was pretty close. There's a few odd things. Like,
the thing with healthcare, though, is sometimes close isn't good enough, right? It's good 99% of the time, and it's kind of like self-driving cars. So there's a mandate for us in healthcare where, first do no harm, and AI, if it does it right 90% of the time and it does it wrong 1% of the time, like that's really hard for us to stomach. So the obligations that we have to ensure that AI is safe and effective within healthcare is probably more than virtually any other industry, because truly lives are at stake.
Mm-hmm. Truly. Yeah, no, I think it's amazing. And it's funny. I think it's just like anything else, as a tool, the utility is pretty powerful, but I think there are parts of it that people really don't understand just how powerful it is. And even when I'm talking with the doctor's team, I'm like, hey, do you mind if I record you? I have auto notes, and sure, I guess, right? But then the end result, when I emailed it over, it is basically looked very similar to the treatment plan. So it's like we are empowered as individuals. And when I think about what Ferrum Health is doing, not only on the technology side, which seems pretty novel and different and standard than other clinical trial companies that I've talked to, it seems that you also are really thinking about the total ecosystem, which I think is pretty cool. And I don't think that this stuff is like every single person really understands what it means to put together a clinical trial and how hard that might be and what that looks like, the time savings that happens and how they're going to win in the end. Now I'm sounding like a commercial for you. I should stop talking about your company and let you talk about it. How about that?
Yeah. And I think if we look at what the ambitions are of typical doctors and hospitals, I mean, everyone wants this change, right? I think we heard from one health system that they had over 100 AI solutions deployed. They were in the middle of implementing another 90. But even with that, They had 500 requests in their backlog for AI tools. So if they're looking at healthcare as something that's not easy to solve, but then you're looking at the sheer amount of tools that are available where we can actually successfully deliver on improved patient care is incredible. So the question becomes, well, why aren't we doing more? And it really comes down to governance. It comes down to the inherent security and safety of healthcare, and the fact that not only do we not have a standardized way to bring all these different AI tools into the hospital, into the patient record, but we don't have a standardized way to monitor them for their impact, their safety, and performance. And as a result, when they're deploying these hundreds of solutions in these health hospitals on patient care, there's no visibility. There's no way to tell, is this algorithm biased? Is it underperforming? Is it delivering the results we want? Is it the best option for us across all of the vendors that we could choose from? And so typical hospitals, they are really just flying blind when it comes to turning AI solutions on. And it's leading to both more effort, less impact, and greater patient risk when they don't deploy AI and manage it in a principled manner.
And so when you think about the solution that you're providing, maybe at a high level, somewhere between an 8th grade and 12th grade level, tell us what's the behind the scenes, unpack it a little bit, how you get to your outcome.
Yeah, absolutely. So Ferrum Health.
Maybe 8th grade. Let's go 8th grade level.
Ferrum Health, we're a company, as you mentioned before, with the mission of democratizing access to AI. And when it comes down to it, the thing that we solve for hospitals is that we give them a simple and easy to use platform that they can use to manage all the different AI vendors they have. They can use to deploy those vendors and AI models into their secure environment without patient data coming at risk, and that they can use to monitor and ensure the safety of these AI tools that they're using. So really trying to
my mind's eye, I kind of think of like, so it's a software architecture. And, as you said, a lot of your clients' customers are plugging in different solutions, right? They have the bespoke things that they're trying to solve. You're giving them basically a dashboard and a back end and a framework to organize that, but then putting in an additional security layer, just saying, listen, if you were doing this quote off the shelf, you might have some problems. Let's put a platform around it. Is that a fair way to characterize it?
Absolutely, yeah. It's this point solution. It's imagine if you had to buy a new iPhone for every application you wanted to download. That's kind of where healthcare is now.
I love this. This is a wonderful analogy. Everyone's like, I get it. I get it. I get it. Okay, awesome. Ferrum Health, you've been CEO for, tell us the journey. So we also have a lot of startups. As you know, I do a lot of work as the board member of Startup San Diego. And so we're always looking at how to innovate in AI in practical ways. Clearly, you're doing this. What would you say about startups as what's been your journey here? You've raised a lot of capital, and congratulations for that. Tell us a little bit about that journey.
Yeah, so I think about startups and more broadly, I feel like the most common pitfall that we see is people wanting to do a startup more than they want to pursue an idea. And I feel like that tends to be, it tends to lead to a lot of companies that you kind of question why they're around, and a lot of founders that can get disillusioned with the process. So it doesn't have to be a mission-driven company, right? You can be really passionate about anything. You can be really passionate about making a lot of money. I know that's all fine.
Yeah, that's what I was going to say.
But being passionate about an idea, like being really excited about an idea, is so much more important than just saying, I just want to start a company. So that would be the first piece, which is, I think anyone that I know who has started a company that has been just really, really interesting, they spent months and months and months and months thinking about ideas. It's almost never the first idea they come up with. The first idea is usually very bad. But as they can iterate and as they talk to more people, as they find things, like they'll come up with things that they never even knew existed in terms of problems. So that, I feel like, is what happened with Ferrum. Before starting Ferrum, I was the founder of another digital health company in the documentation space for healthcare. And that was something that I was also really passionate about, because it was one where I had seen doctors and nurses get burned out by all of the paperwork they had to do. I'm sure you saw this with your own family member as well. And we just wondered, there's got to be a better way to get all this data into the patient record other than the doctor spending half their day doing it. So that was, again, it was another company that was driven by a mission and a pain point that we saw, just like Ferrum is. So when we founded Ferrum in 2018, it was with this goal of trying to unlock the massive opportunity that AI had in healthcare. But in 2018, AI looked very different. So
Yeah, very different, very different.
our company's journey has very much been one where we are evolving alongside our health systems. We're helping them deploy, manage, and monitor AI. And like what that means today is very different than what it meant when we first founded the company, right? There's a lot more generative AI. There are over 1,000 clinical AI tools that have been approved by FDA. And all of these tools are getting more and more expensive and hard to run. And hospitals are no better off. Yeah.
At the end of the day, we have the most expensive healthcare system in the nation, in the world, as I understand it. Probably can confirm that. And it seems to be the most inefficient, yet we are leaders in all of this technology. So it's a real gap that it is so expensive. And so, as you mentioned, cost, this is a huge issue financially.
Absolutely.
As well.
And it's funny because I think there are, regulation is important to have in things like healthcare, where you don't want to be deploying models that harm patients or are biased or discriminate. But also, I think the sort of things that we can do with AI in America are much more limited versus things that other countries are able to do. A great example of this is many countries have much fewer requirements around taking care of really simple things with AI. If you got something that's where AI performs at or better than a doctor, it's not a high risk action. Things like tuberculosis screening, right? Like AI actually does better than doctors do at finding TB on an X-ray. And there are hundreds of thousands of studies every year that someone has to read, and many countries have actually said, listen, like we don't need to waste doctors' times with this. Like, let's just allow an AI read for these screening exams to suffice. And that works.
Makes sense.
Yeah.
But we're not there yet in the US. And we still have to have the human carbon form old eyeball scan what we know, computer vision can accurately predict. Yeah, that seems super inefficient. Wow, that is a great use case. Are you any optimism about that changing in the future, or what needs to happen to make that change?
Enact the Congress. So that's not somewhere. That's not something that we gotta hold our breath for. But
well, it's a good thing our government is doing so well and is so optimized. That was a joke, but we won't get political there. But no, go ahead. So you were saying.
Yeah, and I think just when we think about the opportunities for AI in healthcare, just really recognizing that all of this technology is being put into a health system that is already extremely expensive and is already over budget and under resourced. So the real question becomes, how do you actually enable the adoption of such a massive amount of AI without like bankrupting us as patients and Medicare and the U.S. government? And that's a real challenge problem.
Yeah, no, that's absolutely a huge problem. So when putting the innovator's hat on, because, obviously we solve for problems, missionaries looking for problems, what other things do you see in the landscape of medical that's low-hanging fruit, right, for disruption from AI, with AI, generative AI?
I think that, it's pretty much every single step of every single patient's care journey probably could be made better with AI. And the way that we pay for all of this, the way that we afford it as patients and as a healthcare system, is by recognizing that there are 20 support staff and administrators and additional people working for a hospital for every one doctor that's practicing. And so there is such massive overhead around these healthcare delivery systems, and much of the overhead, without needing to automate doctors or replace the nurse, there are so many opportunities to make healthcare more efficient just by getting rid of all of the overhead. And I think that's a real opportunity that we think about.
I love that. I love that you're really looking at it from a macro perspective and then and efficiencies. And I would say observationally, I think you're spot on.
Hmm.
Now, it leads into what a lot of folks are fearful about AI is like, oh my gosh, there goes my job, right? And of course, we've got to say the obligatory, right? You're going to work smarter, better. We're getting rid of the drudgery. How do you characterize that when you look at the industry about job loss, preservation, or job advancement? What's your lens there?
I think the vast majority of trained medical staff's time in the hospital is spent on low value work. And so the idea that if you could just allow a doctor or a nurse or a respiratory therapist or a physical therapist, if you just allow the care worker to spend their time on the stuff that uh, they got trained for, healthcare burnout is a far greater
Mhm.
issue than worrying that doctors won't have enough jobs. And I
Yeah.
think
Yeah.
solving burnout, solving the under resourced and staffing limitations that we have currently is a much greater problem than being worried about
Yeah.
jobs that may not exist in the future. And contrast this against the fact that you have the boomer generation retiring. So you have one of the largest, you know, demographics in America all entering their high healthcare utilization age, and you don't have a ton of millennials, Gen Z, Gen Xers to care for them. And so, how are we going to handle this massive amount of healthcare that's going to have to be delivered as this huge demographic enters retirement and starts needing more care? I think
Right.
that's going to be something that essentially takes the question of how replacing jobs and turns it into, hey, like, how do we just not have people passing away because we're resource limited? I think that's the problem I have to answer in
Mhm.
healthcare.
Yeah, I love that. I think that's a really good way to look at it. And when you think about the types of jobs that I observe, is a lot of them do seem, there's a bit of drudgery. I mean, from bedpans to paperwork, right? I mean, I'm
Yeah.
not certainly not suggesting like bedside manner robotics, but I know just from the platforms that I've worked on, emotional intelligence robots, actually back into 17 on a Sony platform that was really more for companionship is the Ibo dog. I don't know if you've heard of him, but the bottom line is that there's a spectrum of ways that AI can rise to meet this crushing weight. God love them, but this is probably the bigger issue, and so love that. I think that's really insightful way to recharacterize this.
You look at law, you look at consulting, you look at finance, you look at retail, and all these are industries that have a massive disruption potential with AI.
Mhm.
And in healthcare, you look at it and you listen, like, we're just trying to use AI to allow the people that are working to just do the job they need to do. Like, there's no conversation around replacing uh, healthcare workers with AI. Like, I think there used to be a few years ago, but the conversation has changed because we are so far away from that. We're actually on the other end of the spectrum where we aren't delivering the care we need. Our care workers are delivering and spending their time on not useful things that they wish were automated. And so
Mhm.
it's going to take a long time for us to just get healthcare to where it should be in terms of AI adoption, and just get our care workers to the point where they're delivering and spending their time on things that matter.
Wow. I mean, that's mind-blowing, and I think I spend a lot of time on consumer tech, vertical SaaS, all not so much on the medical side. So this is actually really quite enlightening. This is a really good way to look at probably one of the most important things, our health and our healthcare system. I'm a little blown away, actually, and so this has been super insightful. So what excites you about the future uh, of AI in general, and what do you think paint us a picture of a utopian society imbued with AI. What does that really look like if you were the guy calling all the shots?
It probably looks like a lot less overhead, which is a really boring answer to give you. But I'll go back to the fact, yeah, you've
No
got,
flying needles or not,
yeah. I mean, I'll go back to that.
no distance.
You walk around a hospital, and again, 1 in 20 people is a doctor, and of course,
Mhm.
like that ratio of just how much you have to slog through as a patient with your insurance provider, with your doctor for their medical
Mhm.
records, just trying to coordinate care and schedule visits.
Mm.
Like life as a caretaker and life as a patient should be. Uh, Much more concierge. And so you should be
Mhm.
able to have your disease or your illness cared for without having to become your own project manager, without having
Mhm.
the number of people that have had these
Yeah.
spreadsheets of like this appointment at this point, this medication here, this follow-up, like managing your care journey is kind of an insane thing that patients have to do.
Mhm. Yeah, it's like a full-time job. If
Exactly.
you're here, you
Yeah.
have that chronic, this is why really
Yeah.
you can't work. You really say, yeah,
And
this
then
is real.
And then even with all that work, like the level of care, you mentioned that, our outcomes are not really very, very at all
Mhm.
acceptable for the amount we
Mhm.
spend. And so uh, we're missing a third of breast cancers, even when patients go in and get mammograms. We're missing a third of lung cancers and aortic aneurysms. Patients get lost to follow-up more often than not. There's like a 40% kind of a lack of follow-up rate in a lot of places, and that's with patients that are insured and going into the hospital. And so
Mhm.
you're looking at just an insane amount of work we do as patients that should be automated. You're looking at
Mhm.
an extremely low level of quality of service that should be
Mhm.
better, and you're looking
Mhm.
at extremely high cost of care that should be lower. And all three of those things are the sort of things that, as hospitals start to deploy more AI on patient care, they start to use AI to help manage patients through the journey, automatically reach out and coordinate follow-up visits, remind patients, like all of these sort of, like you mentioned, kind of agentic work, like that's going to transform how you and I manage our care journey. And ideally, that's got to come from the hands of the provider. So that plus what we led with, which is the fact that AI is already just as good at making diagnoses, and it operates as a fantastic safety net for doctors when they're trying to diagnose conditions or trying to figure out what the right decision is to make. I think we don't have to have a path to automation in order to have these really common medical errors stop being missed. And
Yeah.
then cost wise, yeah, you've got to do away with all of this administrative inefficiency. Like for all of the work that you'd have to spend taking care of your loved ones or as a patient, there is, for every one message you send, there are 20 messages going flying back and forth between the hospital, their internal stakeholders, your insurance provider, negotiating and arguing about whether they should pay for your CT scan. And so all of this work under the surface, I think, is just a huge opportunity for us to reduce costs, improve outcomes and quality, and improve the patient experience.
I just as you're talking, I'm just reflecting of, how nice it would be to be able to, as someone who's project managing someone else's care, you're basically like wearing it on your person, so to speak, right? This integrated, I guess I suppose the Apple Watch is one reflection of that, about your metrics, your health metrics, and so forth. But really, it's like we're going to get to this point is where this is what I envision is some kind of scan of some sort immediately instead of filling out paperwork and all of this, some scan that pre-populates everything. It recognizes, your data immediately. Admission happens quickly. All of these things are bespoke, anticipated, custom, and quick. And so is that, I mean, I see a little bit of that today. Is that the utopia you see as well?
Yeah, I mean, I think we all have a vision for, like, if we were uh, be able to receive the care we wanted to receive. I think we know what it is, right? It's like I think some places have like hints of it. Like Mayo Clinic's a great example where you walk in for your cancer care and you get brought around by someone who has your appointment scheduled in a row, and in a few hours you've seen the oncologist, the surgeon, the radiologist, and you've kind of gone through the journey, and the kind of at the end of it they give you this nice handout with all the summary of your visit. That happens at a lot of cancer centers today. It's because, of course, cancer is extremely expensive, and so they have the budget to do so. It also happens in a lot of international centers that do like medical tourism. Now, you can walk into a hospital in Turkey, and in like 4 hours, you've got soup to nuts checkup with like 5 different doctors and a urologist and like, so you can do it, but you do it in environments where there's a lot of funding and a lot of money. And I think that's what AI hopefully allows. It's like, it doesn't matter if you're, seeing a concierge practice with a doctor that only treats the rich and wealthy in Palo Alto, or if you're a Medicare patient. You're able to receive that sort of high quality, low cost, and like extremely patient friendly experience. And the only way we're going to do that is with widespread AI adoption in healthcare.
Wow. I love that. I mean, that's a brilliant response, and that provides a lot of hope. I mean, honestly, it's like, this is not AI for the sake of AI. I think, a lot of talk at the conference is really, are we in a hype cycle? Are we in this agentic app, experience bubble? And I know for a fact, if we look at the last 5 years, or the last 5 major disruptions from PC to internet, smartphone to cloud, all of those were estimated in terms of their total impact by about, the lowest part, 30%, but in some cases up to 50%. So underestimated. And so I believe that we're absolutely not in a hype cycle. Talk about any of the hype that you hear. How do you counter any of that hype? We've covered jobs, but, just that market share. What does it take for us to actually deploy practical AI to this level that these other systems are? What has to happen?
Yeah, so the hype is real, and it tends to center around like individual use cases. So the one that comes to mind most is the belle of the ball right now, or over the past few months in healthcare, has been these ambient listening, these scribing companies, and these are companies that they're the speaker in the room that's taking the doctor's note for them, and writing, taking care of the patient record. Like, that's one of literally thousands of solutions that are on the market. But those companies have raised hundreds of millions of dollars for no other reason than, they're solving a problem for sure, but it happens to be a hot topic. And so I think the idea that a hospital is going to buy one hot vendor and solve all their problems is a very difficult one. Whereas I think if you start thinking about AI and healthcare as being this long tail problem, where there are thousands of different places and ways that you can and should be deploying these tools clinically, operationally, patient engagement, like all these different ways that we talked about that healthcare could benefit from AI, then you realize that it needs to be more of a platform strategy. A really interesting metric that we heard from one of our customers, which is that they were spending $500,000 internally to turn on a vendor that was being paid $50,000 per year. And so they were spending $10 for every $1 they were actually spending on AI, just because they were having to go through all these internal processes, and it was just so burdensome to implement that AI tool. Again, you've got these really outdated systems. You have a really conservative leadership team. Generally, you've got a bunch of stakeholders involved, and you've got all these internal costs that exist. And so, what that means to us is they could be deploying 10 times as much AI with the same budget as they are today, but it's that activation energy, it's that friction that they currently have. And so when we think about how that looks different, like you think about, hey, let's eliminate that friction. Let's give a standardized way to onboard vendors. Let's give them a secure and fully managed place to run those vendors, and let's give them complete visibility into how those tools are performing and their safety and their impact on their patients. And
Yeah, so a dashboard ultimately.
exactly,
And so from the
yeah,
end user, it's like, imagine Star Trek and you have all your indicators in your dashboard. Kind of a silly example, but I think this is what people really want. They just want all their information in the right place in an indicator and just like quick view, just like a dashboard.
yeah,
And I think, I would play a little bit of devil's advocate here in the sense that, there's a lot of patents being filed, which is great. I mean, this is, the pace of innovation, and they're still being vetted. I'm starting to see some that says, listen, we figured out how to stop hallucination, which seems radically ridiculous to me because it's contra to how these systems are actually designed. So I know that there are ways that you can manage hallucinations, and reminding to the listening audience is that it's, unfactual information coming through. And so when we think about the rate of error, Sam Altman had said, I don't know, about 2 weeks ago, if you're using ChatGPT powered platforms, LLMs, the error rate could be as high as 38%. If you're using your own data, it's sub 10%. And I actually did talk to a AI medical practitioner recently, and he said, Cheryl, that is less than the error rate of doctors. Many doctors is sub 10%. It's like, so we are on this trajectory to get better. So long-winded question to ask you, how do you think about fundamental characteristics of AI, and how do you manage those risks with your clients and your platforms, given the nature of, the penalty of error in medical?
yeah. I think that the way that we think about AI today, and I think the way that we research and approve AI is actually dramatically under recognizing the value that it has. Because when you get an AI model approved, what are you comparing it to? You're comparing it to a gold standard, which is basically a panel of 3 radiologists at Harvard or Johns Hopkins or Mayo Clinic or Stanford, who are all specialty trained in the thing the AI is assessing, and kind of confirming in triplicate what the ground truth is, the kind of like golden ground truth. And then you go and look at the environments that the AI tools are deployed, and it's, a generalist radiologist at a community clinic that's massively behind on their studies. They're racing through, and you realize, wow, even within healthcare, like the actual quality of care that we receive as patients on average is horrifically lower than the standards that we hold AI to. And even then, the AI tools oftentimes doing just as good. So I think it's important to have governance in place to make sure the AI tools aren't biased, they don't discriminate. There are plenty of examples where AI tools in breast exams, for example, they are trained on a primarily Caucasian population, and so they underdiagnose Black patients and they overdiagnose Asian patients. Like, that's a very known problem that AI has in mammography. And so there are problems, there are issues, but then I think the desire to be perfect, this desire to do no harm, for AI to be as good as the best doctors at the best hospitals, I think is leaving a lot of opportunity on the table for AI to benefit environment. So the fact that we require the same level of AI performance for a under-resourced care setting in a rural area that maybe they literally wouldn't have been able to get that care.
Right.
I think is a blanket policy that we have as a healthcare system that probably is unfortunately harming those who need AI the most.
Wow, that's so profound. I had no idea how skewed that was. Probably going to be better for them to have AI than to not, and from cost perspective, from overall healthcare outcomes. So this is the future. This is the way innovation is marching forward. We should dispense with the hype, embrace, whatever that is that's driving the fear. I think it's just fundamentally a lack of information. It's also like we have this broken hype cycle in the news media. It's where that yesterday's big headlines was Builder AI. I don't know if you were following that about how, they'd raised a lot of money and they're the promise of agentic AI. And it's like, we've got a huge, offshore team behind the scenes doing. So it wasn't really agentic after all. But and it's unfortunate because I think it really throws shade on a lot of credible things that are happening, like what you're doing. Fella, you are doing some great work. We so appreciate your time and your insight. Tell our listening and viewing audience where they can find out more about what you're doing and any final thoughts about the future for you.
Yeah, check out our website, ferrumhealth.com, FerrumHealth.com. Feel free to look me up on LinkedIn, and we are hiring. So if you're looking for a role that has a lot of mission, meaning, and purpose, trying to advance healthcare and modernize the care that we all deliver, look us up.
Excellent. Thank you so much for your time, and got my eye on you. This is going to be some good stuff coming.
Make sure you're subscribed to Mind the Machine podcast, like the video, and leave a comment letting us know what you thought.